we're going to get started this morning. Thank you everyone for joining us for National Apprenticeship Week. We would like to celebrate this week, celebrate our apprentices and spotlight some industries. So we're really excited to be here this morning. I want to do a couple of housekeeping and then I'm going to turn it over to our Assistant Commissioner. If everyone would please stay muted. We'll also have the chat feature. As you go through the program, you'll find we'll be dropping in chats such as our website link. You'll also see that we will drop in the agenda, as well as you will have the opportunity to take notes if you would like. We have provided that for you as well. When we get to the roundtable industry panel, we will open the chat. We have several folks in the room who will be monitoring the chat as we move through the morning. As well as once the apprenticeship week has came to a close, we hope to place these as live recordings on our website. So this morning, I'm going to turn it over to our Assistant Commissioner.
Good morning. Thank you, Holly, and welcome to all of you for joining us. Thank you for joining us in our first Apprenticeship TN National Apprenticeship Week 2021 session for healthcare, our healthcare industry apprenticeship session. We are so thankful that you chose to join us today. And we look forward to sharing some information around apprenticeships this week and during this session. Registered apprenticeships are a vital piece of our workforce strategy here in Tennessee. And I am so thankful to be able to lead our Workforce Services Division at the Tennessee Department of Labor and Workforce Development, which includes our Apprenticeship TN office. We currently have 7,305 registered apprentices here in the state of Tennessee. That is the most we've ever had here in the state, and I'm so thankful for your hard work to help make that happen. A lot of people believe that apprenticeships and registered apprenticeships are just for trades industries, for construction, manufacturing. But today we're going to talk about what that looks like in healthcare. There are hundreds of programs that we have here in Tennessee that are in more professional or business related industry sectors, including healthcare. And we are thankful for the work that you're doing to help lead that charge in our healthcare industry in Tennessee. Registered apprentices are 95% more likely to gain and retain employment than those who are not in an apprenticeship program. And we are, again, just so excited to be able to share some of that information and share some of the day-to-day working information from our panel later this morning. Again, welcome to our National Apprenticeship Week event here hosted by the Apprenticeship TN office for healthcare, our first session, healthcare session, and we're thankful that you joined us. Again, my name is Steve Plale, and I serve as Assistant Commissioner for the Tennessee Department of Labor and Workforce Development, and look forward to the rest of the session and look forward to the many exciting things to come in our future here in this great state of Tennessee regarding apprenticeships. With that, I'm going to turn it back over to our Apprenticeship TN team and Charlene Russell.
Good morning, everyone. My name is Charlene Russell, and I am the Middle Tennessee Regional Apprenticeship Director. I serve the 40 counties in Middle Tennessee, including Upper Cumberland, Northern Middle, and Southern Middle. And I'm here this morning with my colleague, Shalandria Shaw.
Yes, thank you, Charlene. I am the West Region Director for Apprenticeship Tennessee. I serve the 21 counties in the West, including Northwest, Southwest, and Greater Memphis. At this time, we will just give you a few basics of our Registered Apprenticeship Program, or as we like to call them, RAPs. Since 2019, the Office of Apprenticeship has registered over 7,000 apprentices statewide. It was established and developed to create a greater awareness of apprenticeship opportunities for employers and workers in every area of Tennessee. Of course, it is governed by Governor Bill Lee and powered by the Tennessee Workforce Development System. There are representatives in each agency assigned to lead representatives working with Apprenticeship Tennessee. What we do is serve employers, employers, employers. We do outreach, 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 consulting with employers on program design, developing that registration paperwork to hand off to the United States Department of Labor, working for those employers with the department, and providing technical assistance to program sponsors, employers. Apprenticeship is a flexible and proven talent development strategy that can help grow talent at your company. It is a national structured training and employment program registered with the United States Department of Labor, Office of Apprenticeship. There are 5 components. There is no one size fits all. We must have employer involvement. Employer involvement is key. There is structured on-the-job learning, what we like to call the OJL. There's related technical instruction. That component we like to call RTI. And of course, the apprentices are rewarded for their skill gains, and they receive a national occupational credential. And here is an example of what that certificate of completion of apprenticeship looks like. The on-the-job learning and related technical instruction minimally 2,000 hours equals 1 year. That example could look something like a summer worker who becomes an employee and apprentice. That summer work can be credited. So for every 2,000 hours of OJL, there's 144 hours or more equaling to 1 year. And here the table shows that progression. We have apprenticeship programs that are 4-year programs at minimum 1 year. There are 3 responsibilities of reps, what we like to call the 3-legged stool. The first decisions to be made. We have our sponsor. The sponsor registers the apprentices in our Rapids 2.0 system. And also, those documents, the OJL and RTI hours, are the responsibility of the sponsor. Of course, we need our employer. The employer hires the apprentices, pays the apprentices the wages, and provides the required on-the-job learning and assumes the cost of the training. And then we have our training provider. The training provider provides the RTI, that related technical instruction. An employer may assume all 3 responsibilities of the RAPS program. At this time, I'm going to pop it over to Charlene.
Thank you, Shalandria. As Shalandria mentioned, there are 3 key roles in a registered apprenticeship program. There is a sponsor, an employer partner, and a training provider. Once that decision is made and the program is registered, we like to walk the journey with the sponsor and the employer partner to establish talent pipelines. So you can see here that a registered apprenticeship program is meant to be a full-time, long-term employment training model. So the training hours are defined by the occupation. As Shalandria mentioned earlier, some occupations may require 2,000 hours, some may require 4, all the way up to 8,000 hours. And that model looks like, as the table showed, 2,000 hours is about 1 year of full-time employment. A youth apprenticeship is a registered apprenticeship program that includes 16 and 17-year-olds, and it may be part-time employment. With part-time employment, it may take the apprentice longer to accomplish the 4,000 hours or 6,000 hours required by that occupation. Again, once the program is registered, our team works with the employers to build out talent pipelines. I'd also like to take this time to mention that a registered apprenticeship program, as Shalandria mentioned on the previous slide, the cost of the training does fall on the employer. To build out those talent pipelines, we help set up state-certified pre-apprenticeship programs. A state-certified pre-apprenticeship program can be the education or the related instruction with or without the job requirement. And you can see there on the slide, we partner with colleges, high schools, adult education partners, nonprofits, all types of other partners to help establish those pre-apprenticeships. And the purpose of those pre-apprenticeships is to make sure that there is a pipeline or a pool of talent for employers to draw from who are prepared to go into what could be a 4-year apprenticeship program. We want to make sure that they have the basic skills necessary to complete those apprenticeship programs. With the pre-apprenticeship model, the employer completes a memorandum of understanding with the pre-apprenticeship training provider. And in that memorandum of understanding, it's understood that in the pre-apprenticeship model, the cost could fall on the individual. And so the pre-apprenticeship, whether that be in a college or a high school or with the adult ed, they identify pre-apprentices who have met the qualifications that the employer are looking for, and that employer agrees to interview those pre-apprentices and credit them time either on the job learning if they've worked with that employer before, or they can credit them the related instruction that they've earned in that pre-apprenticeship. So the benefits to employers, why would an employer want to register an apprenticeship program? Well, you can see here that by creating a reliable pipeline of employees, an employer can get higher productivity. With highly skilled employees, you're going to reduce your turnover costs and you're going to have a safer workplace. And you're going to enhance your employee retention. Nationwide, the U.S. Department of Labor reports that for every dollar spent on a registered apprenticeship program, there is a $1.47 ROI. So in the apprenticeship world, there are a lot of myths, and I would like to take just a few minutes to address some of those myths. Over the 18 months that I've been doing this, I've heard some employers express concern that registered apprenticeships are only for unions or large employers, and that's definitely not the case. So there are several small employers across the state, as well as large businesses, union and non-union, who have registered apprenticeship programs here in Tennessee. People often think that they are only for the construction trades or the manufacturing trades. And there are well over 1,000 approved apprenticeship occupations that we can build a program around in several different industries, including healthcare. Some people believe that this is only for non-college bound individuals, when all reality, apprenticeships blend work-based learning and classroom education to make sure that the individual comes away from the program having both the application and the education. And that the federal government will micromanage your workforce and tell you who you can and cannot hire. The Office of Apprenticeship helps you build out that framework. The program is designed and managed by the sponsor of the program. And as the employer, you decide who you hire and fire and how much you pay them. I would like to invite everyone to explore our website, Apprenticeship TN. There's a wealth of information there. I also would like to invite you to follow us on Facebook and LinkedIn to stay abreast of all of the great work that we're doing across the state. And finally, this is our contact slide. So if you would like to reach out to any of us, as I mentioned earlier, I cover Middle Tennessee, Shalandria covers the West, and Holly Freeallard covers the East. You can also reach out to our Assistant Director, Jessica Barnett, our Grants Program Manager, Lynn Kirby, or our Administrative Services Assistant, Erica Hare. Any of us would be more than happy to help you. And finally, your local contacts. So your local business service team is also there to help you access any support services that may be available for your business. Thank you so much for your time and attention this morning. At this time, I'm going to turn it back over to Holly. She will start our roundtable discussion with our panelists.
Hi, everyone. I am Holly Free-Allard. I am the State Apprenticeship Director, and at this time, we're going to enter into our roundtable discussion, which is a focus of healthcare. So I'm first going to introduce each one of our panelists by the region, their job title, their employer, and the occupations in which they have already registered programs within. So I'm going to first start with our East Region with Anita Ricker. She is the Assistant Dean of Workforce and Training at Walter State Community College. Currently, Walter State has a medical assistant, medical coder, and nurse aide. Next, I'm going to introduce Tiffany Limpus. She's also from our East Region. Her job title is Talent Acquisition Specialist. She works for Summit Medical Group and currently has a medical assistant program. Next, we have Dino Harrison. Thank you, Dino, for joining us. He is from Mississippi. He is HR Program Specialist in Performance. He works for Singing River Healthcare, and they have programs in patient care tech, surgical tech, and phlebotomy. Next, we have our statewide intermediary, Laura Ginsberg. Laura is a subject matter expert. She works for Health Career Advancement Programs, better known as HCAP. Thank you, everyone, for joining us. So this morning, I'm going to start off and ask some questions, and I'll direct some of the questions to certain panelists, and others just jump in if you would like to add more commentary as we go. So our first question is going to be for Tiffany and Dino. How has the Registered Apprenticeship Program benefited your company? So Tiffany or Dino, whoever, go ahead. I think you're muted, Dino.
I was going to say, go ahead, Tiffany, but I'll tell you one of the major benefits that we have is, as you mentioned in the slide just a couple seconds ago, was the increase in recruiting pipeline. As we know, just like financials coming into your house, the more pipelines you have, the less, disaster it is if one fails. But also one of the things that I didn't realize at the beginning was the level of expertise that would raise throughout. Our preceptors are preparing to come in and work with these apprentices. So when you're looking at it, their excitement is regenerated. And I will tell you that is probably the byproduct of the apprenticeship that was unexpected, how everybody else will be energized and ready to go to work with these apprentices.
Thank you, Dino. Tiffany? We can't hear you, Tiffany. So while we try to figure out why Tiffany, we can't hear Tiffany, let's move on to our next question. So Laura, this question is for you. How do apprenticeship programs benefit employers within the healthcare industry? Laura, can we hear you now?
Can you hear me?
Yes, thank you.
Okay, I think it was something on your end. It kept telling me that you had control of it. So the question was, how do apprenticeships benefit employers? Well, I think it benefits employers in a number of ways. As Dino was saying, it helps to create a pipeline. It also, apprenticeship is a method of training. It's that combination of on-the-job learning and then that didactic instruction that is really embedded into the healthcare system. And it's used predominantly with the nursing and then doctors. You've got your residencies, you've got your clinics. But with apprenticeship, there are over 40 occupations that are apprenticeable. And so you're able to expand that really great method of training healthcare professionals to a lot of other different occupations. So we have apprenticeships from CNA, home care, surgical technologists, dental assistants, coding. We have people that work in behavioral health. I mean, just a whole range of occupations where you're able to train. So I think being able to institute the training model in other occupations is really going to help hospitals and other healthcare providers really professionalize their staff. And what does that mean? That means better patient care, better quality care. So I think that's one of the things besides the pipeline. And then I think that there's a tremendous ROI. Right now we're seeing, with this crazy COVID, people are leaving their jobs right and left. We're seeing where HR departments are, they're bleeding employees. And we've heard that it can cost between $4,000 to $5,000 per employee to try to replace them. On top of that, hospitals and providers are paying for visiting nurses. Well, they charge double what a normal nurse does. So by having this registered apprenticeship program, you're able to grow your own. You're able to keep those employees with you so that you can stabilize your workforce. With a registered apprenticeship, they have a contract where they have to stay with you a year, 2 years, whatever that length of time is needed for training an apprentice. So I think those are some of the benefits of an apprenticeship for employers.
Thank you, Laura. So I'm going to go back to Tiffany. If Tiffany, I hope now we've got you fixed as well. If you could go back, circle back and tell us how the Registered Apprenticeship Program has benefited your company. Okay, so we'll move on. This is also for Tiffany and Dino. And Anita, I'm going to ask you to jump in on this question as well. So what is the primary challenges you faced in implementing or operating an apprenticeship program? And how did you overcome those challenges? So I'm going to ask at the end if Anita can help us and how she has helped companies overcome their challenges as being a partner in this industry. So Dino, if you would like to start off.
Well, when you look at it, all programs have challenges. When you're looking at how do you overcome them, you overcome them by communication. You overcome them by recognizing and analyzing them. No different in healthcare, no different in the apprenticeships. Some of the issues that we were seeing is, at least in Mississippi, where healthcare apprenticeships are relatively new, it is overcoming the mentality of something new, something different, something changing. And when you're looking at that, the biggest key to that was communicating how we currently train. As mentioned, to me, apprenticeships are clinicals on steroids. We do them in the healthcare industry all the time, but because we call them apprenticeship, everybody started to get nervous about them. You're looking at mentors. We precept all the time. We have preceptors. So it was communication, fine lining it and connecting it to what is traditionally been used. Not to mention healthcare probably was one of the first apprenticeship programs in the United States, just was not mentioned. A diploma nurse was an apprenticeship. They were paid while they learned, they put out a quality product, and they were able to get their license. So bringing that information back and necessarily communicating that to them was one of the huge barriers that we had at first. Next, I will tell you, you cannot develop any of these programs in a bubble. The Board of Nursing, if you have a surgical technology program that is guided by the state, contact them, contact any community college as an employer, because the good thing about apprenticeship is there's really two types of apprenticeship. You have the employer-sponsored one, and you can have your academia-sponsored program, to where you're looking at who controls the majority of it, but also who's also doing most of the work to attract the apprentices. So when you're looking at it, those barriers, you can't do it in a bubble, but reaching out to those will help communicate it. Also, what helped me relieve some of the barriers was reaching out to the other states that had programs already established to see how they did things. I will tell you, we're all looking to do the same thing: train, recruit, and develop our workforce. So believe it or not, the more you communicate, the more you get out, some of those challenges will be removed.
Thank you, Dina. Tiffany, can you hop on now? Can you hear us, or can we hear you? Anita, I'm going to pass it over to you and help us out with decide what you do with the community colleges.
Okay, can you hear me now?
I can hear you. You're good.
Okay, great. I would echo some of the things that Dino just said. I think it's communicate, communicate, communicate. Again, from our initial outreach to Tiffany and Summit Medical, there were some concerns about what else am I taking on, what else is going to be required of me, but recognizing that healthcare was, even more in demand for qualified employees, and healthcare was facing some challenges, as well as education, as well as every other business that no one had ever faced before. So nothing like launching an apprenticeship in the middle of a COVID pandemic world, but it may have been beneficial in a weird sort of way. But we tried to communicate with the employer. Walter State has been the sponsor for all the apprenticeships that we're working with. And I think that really helps the employer of taking some of the burden of the reporting and the tracking and the support. Most of the healthcare apprenticeships that we've got started have been online support. So we've also had counselors that have been assigned to those individuals to stay on track. We get reports on a weekly basis to say so-and-so is logged in, and if they haven't logged in 30 days, then one of my staff will reach out, as well as counselors that are assigned to them, to say, hey, what's going on here? Is it just busy? Is it just life? Or are you having some technical issues? What can we do to help? So most of the time, it's just been a friendly reminder of, hey, life has happened. It's been busy, or, I've been working 60 hours a week and I haven't had an opportunity to log back in, but I'm still on board. I'm still online. So again, communicate, 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 but reminding those individuals of the goal and helping them recognize that we're here as a support network. And in fact, as we've started through apprenticeships, the college has offered up all of the counseling services, even though some of these have been offered through workforce training. So again, they have a tremendous amount of support of college resources if they need them. Most have not, but we've had one or two that we've went above and beyond to try to help them through life circumstances and help support them in any way we could.
Thank you, Anita. Tiffany, have we got you yet? Okay, we're going to keep moving. So Laura, this question is for you. What are the primary challenges sponsors and employers face in implementing and operating an apprenticeship program within the healthcare industry?
Well, I think some of the challenges are, I think Dino alluded to it, was introducing a new training model into your organization. People are very used to doing what they're used to doing, their training model. So to have something new come in, they're very skeptical. So I would say that's a huge challenge. But I also think that when it is introduced, especially on some of these frontline levels, other people are really excited about it because they see, wow, there's this new training program for us. Perhaps we haven't had anything quite as structured as this. And they get very excited. So it generally has a very positive impact. I think another one of the challenges is working with the nursing boards. I don't know what it's like in Tennessee, but they're not used to registered apprenticeship, and they're very set in their ways. And it really takes a lot to try to convince them that registered apprenticeship is not going to take away from a program, but it's actually going to add on to it. So those are kind of the basic things that we found as far as the challenges for introducing registered apprenticeship in healthcare.
Thank you, Laura. Next question, Anita, is for you. Can you give us an example or some advice for how the community colleges and TCATs have developed innovative programs to help the instruction or the RTI portion of an apprenticeship program?
I think you have to look at what's the best fit for the customer, whether it be online, on ground, some combination thereof. Some people have reacted really well to Team and Zoom. Others wanted programs that were available outside of the traditional workday, and they wanted to be able to do it when they wanted to do it. So again, it's more of an online version. So keeping the customer in mind, also developing those strong relationships with your healthcare partners is very important. Walter State had previously offered clinical medical assistant, medical coding, nursing assistant. We do RDA, phlebotomy. We had a lot of those programs available already before we implemented those into an apprenticeship. But it's actually been good for us in that some of the typical externships where we would have lined up has actually been done at the clinical site where they are actually an employee. So that's been beneficial for the healthcare partner as well as for us, as well as for the student.
Thank you. Tiffany, you want to try one more time? See if you can share with us a little bit. I'm sorry, Tiffany. I apologize. I apologize to you for some reason. We just cannot get your mic working. Okay, so I'm going to jump to the next question. This is really for the companies as well as Laura. I think everyone could probably benefit and help out on this question. So we'll start with Dino and then just have a roundtable discussion. What costs are associated with your registered apprenticeship program for your company? Who pays tuition? And do you have any grants or any types of funding to assist with that type of financial assistance? So Dino, if you want to start first, and then we'll just go around.
Well, thank you, ma'am. Well, first of all, I will tell you training is very expensive, and that's why it's a multi-billion-dollar business in the U.S. But most of the costs that you're getting, the student or the apprentice is earning. You're not hiring apprentices to fill spots that you don't have. So you should be hiring apprentices that are targeted to spots that you have, which means that position is either vacant or getting ready to be vacant. So you got a little bit of pay increase. You have training location. You could have college tuition that all come into it. But with the funding available with WIOA, sometimes if the pay is more than $12 an hour, you can get some of that payback for up to the first 1,000. Subsidiaries like HCAP and Miss Laura and them will assist with tuition, college classes. They will also assist in tools, equipment, and things like that to help set up programs. Not to mention, if you're providing the instruction, you can get some of the instructor payback through your federal state programs. So when you're looking at it, yes, there are expenses. Training, having a location. Hospitals are not necessarily the best with having educated, dedicated rooms. Over the last year, we've just turned 2,500 square feet into 3 classrooms and 3 simulation rooms. Now that costs $75,000. But again, the return on the investment is going to come back when we decrease our recruiting costs. We retain these individuals. So when you're looking at it, it might be a little bit more money up front, but the return on the investment will come back. And when you're talking about the level of expertise, you're talking the retention, and then you're also talking about the capability of instilling your culture into the training and into the individual from the very beginning. All that is priceless. But yes, there are some associated costs, but there are capabilities of getting some of that refunded using subsidiaries like HCAP or your local WIOA and WET fundings.
Anita or Laura, would you like to add?
Sure, I'll jump in. I thought Dino did a really good job of outlining some of the costs. And WIOA, there are lots of grants from the U.S. Department of Labor, Office of Apprenticeship, to states to help organizations, employers get started with their apprenticeship program. The Department of Labor also funds us. We're an industry intermediary, and our goal is to expand registered apprenticeship throughout the nation. And they also have given us incentive funding that we're able to pass on to organizations like Dino's to pay for that instruction, the didactic part, we can pay for virtually everything with the exception of wages, and the employer is expected to pay wages. But with the registered apprenticeship, the apprentice gets a reduced wage until they complete the program. So that's somewhat of a benefit to the employer, where you're getting an employee who's not fully productive, but will be at the end of their apprenticeship. And I also thought Dino made a really good point about look at your entire budget. Yes, training is costly, but so is that recruiting and paying for those traveling nurses. So it's looking at all of those budget items and kind of reallocating some of those other expenses to training that ultimately will reduce your overall costs.
Money from Holly and Tyra and Jessica. So that worked really well for medical assistants, medical coders. Also, by partnering with the community college and TCAT, they can streamline into some other resources that can be extremely helpful. And from the employer standpoint, we work with customized training all the time. And if you look at, you spend $2,000, you spend $3,000 or $4,000, you spend $10,000 on training, you've got to look at the cost of turnover if you lose that person. So the data that I've seen recently, and I've got every wage calculated, but a $10 an hour employee, to keep the math simple, is about $25,000 to $30,000 in cost of turnover for any organization. And healthcare may be even more than that because of some of the extra precautions and things that you have to do for onboarding. So again, training. I think the training and investment in the individual and the apprenticeship, the mentorship, I laugh and say when I came to Walters State, I had an hour introduction with HR. I had an hour introduction with my boss, maybe 45 minutes. I had an hour introduction of how to order supplies in the bookstore, and that's pretty much it, ready, set, go. And I said I was lucky that I had individuals that I was partnered with that mentored me without me really realizing that. But I think that's the benefit of the apprenticeship, is it gives that structure for that employer to also know where those individuals may need help. They begin to take on your culture, gives you an opportunity to invest in them. And in the training and development surveys that you look at, and recruitment strategies, training and development is always in the top 3 of why people stay. So that helps also to get individuals in and keep them. And I didn't throw this out there earlier, Holly didn't pay me to say this, but Holly's been a tremendous resource because of her background in healthcare. So reach out to your Tennessee apprenticeship staff also. They've brought some things to the table that saved me a tremendous amount of time to cut my cost in turning this around for the employer.
Thank you, Anita. And Anita, I'm going to kind of ask if you can help, since Tiffany, we're having that issue with her being able to hear. I know you and Tiffany have a great partnership and relationship in developing a program. So since Tiffany can't talk, could you just share a little bit about the program that you and Tiffany have developed together, how you helped her develop that program, and how it's doing right now? I would really appreciate it if you could step in that little role for Tiffany.
So Tiffany, if I screw this up, I apologize, but Summit Medical is a employer in East Tennessee that covers several counties. Walters State has 10 counties, and I think they cover all 10 of those counties, plus some borderline Middle Tennessee, Knox County down to south of Knoxville, maybe closer to Chattanooga. So initially, when we found out about the TBR Department of Labor grant, we went to some of our healthcare partners, such as Tiffany, that was currently hosting some of our externships as a way of saying, hey, we can give back. We can train some of your individuals. And I don't know, I'm going to guess and say maybe Tiffany took 20 seats pretty quickly, and we had 47 seats statewide. We had 4 employers that we worked with. Summit Medical was one of those 4, but Tiffany was by far the employer that put the word out, and people just went crazy, wanting on board, wanting to get in. And the funny part was, as the employees got started a week or 2 in, then word began to spread of friends that wanted to get involved in other small medical offices where they talk, and they wanted to get involved. And we came back after those 47 seats and said, hey, they still have need. And Tiffany was consistently reaching out And I think there was an additional 20 seats that was provided to Summit Medical with a small charge to get them going and get them started on the process. So again, if Tiffany was on here, we were talking last night, I think probably she could use another 20 or 30 seats because, like I said, now word has spread. We're a year in, there's graduates coming out of the program. The doctor's offices see benefits in that, being able to assess people much quicker. During COVID, when people were out, they had backup staff that could get the patient to the doctor much quicker. So again, it's been a win-win with Summit Medical and the partnership that we have. They were a great partner before on externships, but the apprenticeship has been very productive for them. And again, for people to be able to complete during a COVID year, it was even more important for that certification and for that benefit.
Thank you so much, Anita. Last question that I have for our panelists is, could you give or provide the best piece of advice for another employer or even a sponsor who potentially would like to do an apprenticeship program? What would be that piece of advice you would give them? Dino, we'll start with you.
The best advice that I would get them, of course, is with any project, the more planning and collaborations that you have established and the communication you do before the program starts, the better. But I will tell you, sometimes you just got to jump. Communication with your local community colleges. They've been used to training and they're used to dealing with all the academia side. Reach out, communicate other states, reach out, because truthfully, we're all on the same team. And I know a lot of times in healthcare and academia world, there's a lot of competition. But when you're looking at it as a statewide, if you don't train and develop your healthcare individuals there, no matter where they work or where they're going to work in the future, your life's at risk. And that's when you start looking at it. And as the shortage raises throughout the U.S., and especially in rural healthcare, and Tennessee is no different than Mississippi, we have a large rural healthcare population. It is very challenging to get these folks to come work. And studies have proven to get the employee there is to come from that population. So that's even more of a reason to get these apprenticeships going up and running. Don't wait, because this is something that is catching on. But the longer you wait, the longer you're delaying the apprenticeship graduation and the recruiting pipeline, because everything takes a little time to get going.
Thank you. Laura, do you have any advice?
Sure. Well, in addition to what Dino said, I would definitely have an open mind. Don't just look at your traditional ways of recruiting and training. And look at all of the resources at hand. In Tennessee, you have the Office of Apprenticeship. As Anita said, Holly and the staff are really fabulous. They will help you get through it. There are lots of resources. Look at your high schools. High schools are a really great resource for partnering to really create that talent pool of individuals who may go off to college somewhere, but they may come back. We've seen a lot of high school programs where their loyalty is really at home and they want to stay, they want to come back home and they want to work at a facility that they're accustomed to. So keep an open mind and look at all of the resources around you, because there are a lot.
Thank you. Anita, would you like to add?
So in the last several years, I've served as an examiner for the Tennessee Center for Performance Excellence, and there's a phrase in that organization that says, trust the process. So again, trust the process. Like Dino said, don't be afraid to jump. At some point you can overanalyze it to the point where it's paralysis by analysis. And yes, I work at a community college, and yes, I get a paycheck from here, but I'm going to say reach out to community resources, reach out to community colleges, because we have boots on the ground with both the high school and dual enrollment. We have boots on the ground with people wanting to come back and train. Maybe life has happened and it's thrown them in a different economic status, and they have to come back and gain some skill set. So we have websites to post, job openings and things like that. But reach out to your community colleges and your TCATs, because they have a lot of resources and have boots on the ground in a lot of different areas. And If you don't have that partnership with one of those local community colleges and they won't respond to you, let us know. I also serve as the East Tennessee Regional Rep for the Center for Workforce Development with the Tennessee Board of Regents, and we will find someone that can work with you. Dr. Carol Purrier would be very happy to entertain a call from you and say, hey, who's in my area if you don't know?
Thank you so much, Anita. So we have about, close to 10 minutes left. I just want to be sure that all our questions in the chat were answered. Give anyone, if they have an additional question, real quickly to ask, and then we are going to close out. We are also going to drop in the chat our contact information for the apprenticeship team here, so you'll have that information for you. And again, Tiffany, I apologize for the technology issues, but we do appreciate you joining us today. Any further questions? Panelists, I appreciate you so much for joining us today. I'm going to turn it over to our Assistant Administrator, Tyra Copas, to close us out.
Hi, everyone. Wow, what an amazing session. And thank you so much to the panelists. I am so excited about their comments because we have, over the last couple of years, really had a lot of interest in healthcare and healthcare occupations and moving them into an apprenticeable program for many employers. And I think you have heard from the experts today how they can work and what the benefits are. So I am really excited to see and be able to watch the apprenticeships in healthcare grow after this conference. So I have had the honor, like Holly said, I'm the assistant administrator in workforce services, but I have had the honor of being part of Tennessee's apprenticeship journey over the past 2 years. In 2019, the state recognized the impact registered apprenticeship programs make when it comes to developing that high quality, skilled workforce for Tennessee. And following this vision, the Apprenticeship Office was established to help Tennessee employers set up new programs, support existing programs, and create partnerships across the state. Again, all in line with supporting the workforce initiatives in Tennessee. Since 2019, the office has hit multiple high numbers, specifically around new number of programs developed, the number of individuals completing their apprenticeship programs, and now we're hitting an all-time high with the overall number of apprentices. And as Steve Plale mentioned in the entry comments, we're over 7,300 apprentices in Tennessee, and that is a 33% growth since 2019. So that's not by luck. Well, I'll say some of it's by luck, but for the most part, that is because it works. So apprenticeship programs work. I think you've heard from our panelists about how they work, and we are seeing that success in Tennessee. When I think about apprenticeship programs, I really put it into 3 buckets. The first that comes to my mind is around the individuals and the impact apprenticeship programs make on individuals' life. So they offer that high quality career pathway for the individual where they can obtain paid work experience under the supervision or under that dedicated mentor. And as we all sit in our roles today, many of us did not have that opportunity. As Anita mentioned, it is a few hours of here's some information and then you're out and about on your own. And so with that dedicated mentor, that person is getting primed for success, which adds to their longevity with that employer. They also receive the needed instruction that goes along with that. So they're getting that academic piece as well as the work experience. In addition to any credentialing these programs may have, they're also obtaining that national, recognized, and portable credential throughout the United States. Most importantly, it is a means to a secured future, especially in our rural areas. These individuals will know exactly what they need to do and when those increases will come into play. And for those programs that are 2 to 4 years long, knowing exactly when you're going to get that increase and increased wages is that carrot on the stick to keep individuals employed with your company and moving through that program. And then all of this is wrapped up in a nice bow for that individual without any debt. So apprenticeship programs, as we talked about, there's no debt for the individual. And so we on the apprenticeship team, working with our community colleges, working with our intermediaries, we're trying to help offset that cost for the employer to make sure that, you know, these programs are not only sustainable, but there is a means to higher wages for these individuals. The more we can offset costs for employers, hopefully the more they will be able to hire. The second group is for employers. I think you've heard a lot about that today, but apprenticeship programs allow the employer to influence that training. They develop the training with the sponsor or the college system. They have input to that training. And most importantly, they're being trained specific to the skills that they need on the job. And a result of all of this is that higher retention rate. So you're bringing them in and they're staying with the employer longer. And then the last bucket that I think about is the community. So what do apprenticeship programs do for our community? The apprenticeship model provides the best implementation of the public-private partnership because it improves the workforce, it supports local employers, and it changes the economic trajectory of households, specifically in our rural areas. And so I encourage you, when you're thinking about apprenticeship programs, to think in those buckets. You know, how can an apprenticeship program advantage the employer, advantage the individual, and advantage the community? So we've heard from the great panelists, and again, thank you so much to all of you. But so what do you do now? So you're on this conference for a reason. So what is your next step? And I would boil that down to one thing: connect. Whether that's connecting to the apprenticeship office, connecting to your community or your community college or your TCAT, connecting to an intermediary through organizations in healthcare like HCAP. Connect to your local workforce board and your local American job centers and your regional directors in your area. So no matter what path you take to connect, they're all tied together and they work very, very well together. So your key takeaway or the key action item that I would give you today is to connect. So in closing, let me just reiterate, the success Tennessee is having in apprenticeship is in large part to the team's dedication, the apprenticeship's office dedication, their diligence in working with employers and supporting our Tennessee employers, not to mention the long hours and the many miles they've accumulated on the road visiting these employers even through COVID. But it's also in part to the many partnerships we have in the state. And those partnerships include Tennessee Board of Regents, our Adult Education Office, the Department of Education, so our K through 12 groups, Department of Corrections, Department of Human Services, our Economic and Community Development, and many of our industries and all of our industry intermediaries. And of course, last but not least, the workforce boards in each of the 9 local areas in our American Job Centers. So I would specifically like to thank those of you who were involved today. Thank you to the panelists again for sharing your personal experiences and how you set up the programs, the registered apprenticeship programs in your area. Want to thank the apprenticeship team for pulling this together. Holly, Jessica, Charlene, Shalandria, Lynn, Erica. If you don't know those names, you probably will, that they do tremendous work. And then also want to thank our Tennessee Workforce Assistant Commissioner, Steve Plale, for his opening comments. And so with that, I'll give a minute to check the chat for any additional questions. And if none, we hope you found this session very valuable, and we hope you enjoy the rest of your day.
Thank you, everyone.
Thank you.